Hi, everyone. I'm Dr. Sheppard. Welcome to day two. So, today we're going to talk about what happens when you come back for that second visit in our office. And the reason why it is split up into 2 days is because we want to make sure we are doing everything that we can to make sure that your care plan is customized and that your child or yourself feels comfortable enough with starting care and to make sure that we have all of your questions answered. So, day two is really, really important. So, as we go back through what happened in day one, you came in, you got your tour, you spoke with, it could depend. You spoke with either, one of my staff, you had lactation with Kaylee, or you sat down with me and we kind of went over your kiddo's concerns. Then you got your scans. So it takes us a while to kind of go through the scan and analyze them. The scan makes the care plan. So we need to see the scan to determine what the care plan is going to be for you or your kiddo. So day two is when we bring you in and we sit down and we go over all of that. So we go back through what happened during day one, kind of what we found, what we saw, and then we're going to lay out your scans and we're going to go through each one of those scans and kind of correlate the scan findings to kind of what's going on with you or your kiddo. And so, depending on if your kid's coming in for colic or constipation, if they've got a sports injury, if you are pregnant or you're trying to become pregnant, each one of our scans is actually important for certain things. So, HRV is going to be important for our stressed out mama, for our kiddos that are struggling with anxiety. It's also really, really important in infertility. We want you in certain ranges in that HRV to make sure that you can have a healthy pregnancy. The postural energy scan. If you have an infant or a kiddo that's less than 5 years old, they are not going to get that scan. It's just too hard for them to sit, and if they're a baby, they obviously can't sit. But if you're an adult that struggles with headaches, tension, sports injuries with kids, those are ones that we really look at postural energy. And then the thermal is the one that we really look at for the babies. So birth trauma, colic, constipation, fussiness, the thermal tells us all we need to know for those babies. So we sit down and I actually go through each one of those scans with you and we go through the findings and we correlate everything. And so, we really want to explain neurologic chiropractic to most of you who don't quite understand what we do because you think we're back and neck doctors. So this is really, really important to understand how nervous system chiropractic is so important in treating babies and treating non-traditional pain. So we go through all of that. Then we're going to go through you or your kiddo's customized care plan. And so I spend a lot of time going through the scan and determining how long it's going to take for you or your kiddo to feel better. And there's a science to this. We pretty much know what, a colic treatment plan looks like. We know what, a pregnancy treatment plan looks like because we want to treat you into the postpartum. And so, we want to get your lactation appointments in and those sort of things. So we sit down and we go through you or your kiddo's customized care plan. Everyone is different. Every care plan is different. We also know that you are busy and we want to set out expectations and we want you to know how long this is going to take from the start, because there's nothing worse as a busy parent than to go week by week and to not kind of know what's coming ahead. So our goal is to lay everything out for you. We get your ideal schedule. If your kiddo is in school and needs to come after school, we factor all of that stuff in. If you're a working mom and you can, only come during your lunch hour, that's important to us. We also have an app system that we will put all of your appointments in. You can import those into your calendar. You can two-way text us. We want to make it as easy as possible for you to come in and make it convenient, because a lot of times, and at least initially, you're going to be coming in for multiple visits a week. So we want you to know that you're, how long you're going to be here, how long this is going to take, how many visits a week, everything's going to be laid out for you so you know what to expect. And that's really your choice to say, yes, I'm committed to you. I'm going to, commit to the care plan. Because in our office, we don't do the let me try chiropractic. We know chiropractic's going to work for you. Otherwise, we're not going to sit down and have this whole day too. And so we know it's going to work. We just want you to commit to the care plan and commit to giving it the time and energy, because we commit that to you. give you a, specialized appointment time. We're going to spend the time with you. And so if if that's something you're not willing to commit to, that's okay. But we want to set forth those expectations from the start that we expect you to commit to the care plan. We are flexible. We can make some minor tweaks to it, but we want you to be okay with everything before moving forward. And then our financial manager is going to come in. She's going to go over all of your finances. So, it's really, really important as a mother myself, we don't want there to be surprises. We don't want there to be a bill that shows up at the end of the month and, the charges were something that you didn't expect. So we lay everything out for you. We even set up a payment plan if you need that as an option, just to make life a little bit easier for you and more affordable if you need that. So we do currently bill Blue Cross Blue Shield of Illinois. So we will factor all of your insurance into your treatment plan, so you will know, hopefully what your insurance will pay. But we factor that in and explain all of that to you. If you are a cash patient that doesn't have Blue Cross, we just kind of go over our cash discounts and ways that you can pay and receive other discounts. And so Erin lays all that stuff out for you. So, other than, a crazy Blue Cross issue, there should be no surprises about your treatment plan. And so we do this all to just to make things more convenient for you, make things easier. You know what to expect, you know what's coming, you know how long you're going to be here. And then everything from then on just really goes so quick and easy. You're not stopping at the desk, you're not scheduling appointments every time. You can reschedule your appointment in the app if something comes up. You can two-way text us. So we really set it up for a busy mom, a busy family, because we are busy working moms. So we get it. And we're trying to make this as easy on you as possible. And so if everything looks good and everybody's on board, then you get to get your first treatment. So we will take you back to a room. We love to celebrate our people joining care and having their first adjustment. Our babies get their picture taken. Kiddos get their picture taken if they want to. We just really celebrate you joining our family. And so we make it a big deal. We explain everything to you before, you actually get your first adjustment, but it's usually a really big day and we celebrate that in the office to have more people join our family. So hopefully that is helpful for you. But if you have a spouse, a partner, someone who is making your financial decisions, we ask that you either bring them to your day 2 or you can FaceTime them in if we need to go over the scans together. We will be happy to answer any questions over the phone with someone. But, we do like to have that financial commitment before we take you back and get your first adjustment. So if you are not prepared to make that financial commitment, if you need to go home, talk to your spouse, talk to your partner, then, we just will begin treatment on a different day. So we just want you to be aware of that. We're happy to FaceTime somebody in or, put them on speakerphone. So we do that all the time. We know it's hard for people to get away from work. So we get that. We can also do virtual day 2s. If it's just really hard for you to get into the office, we can do a virtual day 2 and talk through that over the phone. So we try to make it as easy as possible for you guys, but we are just super excited to have you in our office and come back and commit to care. So hopefully this is a little bit helpful to give you some expectations of what comes forward on that day 2. And we look forward to seeing you for that visit.